certain medications are unsafe in pregnancy? Do you know that self-medication is dangerous? Before we move on, guys, kindly subscribe to my YouTube channel and please like my video at the end of this. Pregnancy is a very crucial stage in a woman's life. It is divided into the first trimester, second and third trimester. Do you know that the most dangerous trimester is the first trimester? Because this is the important stage of organogenesis, also known as development of the body organs. As such, many medications are clearly unsafe at this stage and would cause teratogenicity, which is known as congenital malformation in the fetus. The malformations can manifest in different forms. You could have absence of organs due to the absence of the first created or developed organ in the child, known as agenesis. You could also have what they call aplasia, which is absent organ development despite the presence of the precursor first created tissue. You could have incomplete organ development. You could have secondary breakdown in a previously well-developed structure. Others would include deformities, malformations, all as a result of taking medications that are not prescribed by your physician. The culprits, however, to these congenital malformations that are noticed in fetus are 1. Fluoroquinolones. Fluoroquinolones include like your regular ciprofloxacin. These drugs would cause cartilage damage in a baby. We have folate antagonists, which would cause neural tube defects. We have lithiums. We have metimazole. Metimazole is an antithyroid drug, which will cause congenital absence of skin, particularly on the scalp. We have the tetracyclines, which will cause discoloration of teeth and inhibit bone growth. We have the angiotensin converting enzyme inhibitors. Number 1 would be lisinopril or ramipril or captopril. These drugs are not safe in pregnancy. They could cause congenital malformation in a baby. We have anti-epileptic drugs, which would also cause neural tube defect. However, if you must take these drugs, you have to be on high dose of folate supplements. Other drugs would include warfarin, diethylstilbestrol, thalidomide, alkylating agents. So clearly you can see a list of many of these drugs that can cause congenital malformation in a child. It is therefore advisable when you're pregnant to avoid these medications, especially at the first trimester of pregnancy, which is the early stage of your pregnancy. So once you avoid these things, you're able to have a baby that is disease-free, abnormality-free. Thank you very much for listening, and please always consult your physician before you go ahead to take any medication.